COVID-19 vaccine, no link to heart attacks, Health Minister Nadda explains. In a striking revelation that may surprise many, Union Health Minister J.P. Nadda stated on July 25, 2025, that the COVID vaccination does not influence the likelihood of experiencing heart attacks. This assertion was made during a written response to inquiries in the Lok Sabha, where he also pointed out a significant gap in data collection. There is no centralized system for tracking heart attack cases in India. Nadda explained that heart attack incidents are not classified as notifiable diseases, meaning they do not have the central registry for monitoring. To delve deeper into the factors contributing to heart attacks, the Indian Council of Medical Research, ICMR, initiated a comprehensive multi-centric matched case control study across 25 hospitals in India. This study focused on patients aged between 18 and 45 who were admitted with newly diagnosed acute myocardial infarction, AMI, from October 2021 to January 2023. The control group consisted of patients of the same age range who were hospitalized for different medical issues, ensuring that the timing of their hospital visits was comparable. The researchers gathered extensive information on various risk factors associated with heart attacks. While sharing preliminary findings from this yet-to-be-published study, Nadda highlighted that hospitalization due to AMI was notably linked to the presence of known comorbidities, a family history of thrombotic events, and a history of smoking. Crucially, he emphasized that receiving the COVID-19 vaccine did not alter the risk of developing AMI. Even among individuals without any pre-existing health conditions, a family history of thrombotic events and a history of smoking were found to increase the risk of heart attacks. In addition to these findings, Nadda informed the public that over the past 2 years, the ICMR has allocated funding to establish 2 advanced research centers dedicated to studying cardiac disorders. Furthermore, the National Health Mission, NHM, is actively providing both technical and financial assistance to states and union territories through the National Program for Prevention and Control of Non-Communicable Diseases, NP-NCD. Cardiovascular diseases are a key focus within this program. As part of this initiative, a network of 770 district NCD clinics, 6,410 community health center NCD clinics, and 233 cardiac care units has been established across the country. Additionally, a population-based strategy aimed at preventing, controlling, and screening for common non-communicable diseases, including diabetes and hypertension, has been launched under the NHM, emphasizing comprehensive primary health care. This initiative specifically targets individuals over the age of 30 for screening, as stated by Nadda. This information raises important questions about the relationship between vaccination and heart health. Could there be other underlying factors that contribute to heart attack risks? What are your thoughts on the findings shared by the Health Minister? Join the conversation in the comments below. ICMR study debunks COVID-19 vaccine sudden death link. A recent study has upended long-held beliefs about the relationship between COVID-19 vaccines and unexplained sudden deaths, revealing that the vaccines do not increase the risk of such events among young adults. Union Health Minister J.P. Nadda highlighted that the Indian Council of Medical Research, ICMR, found no significant correlation between vaccine receipt and sudden death, despite earlier concerns. The study emphasized that factors like prior coronavirus hospitalization, family history of sudden death, and lifestyle habits, such as binge drinking or excessive physical activity, were more closely linked to unexplained deaths than the vaccines themselves. The ICMR and National Center for Disease Control, NCDC, employed 2 distinct approaches to explore sudden death causes. The first was a retrospective case control study, analyzing data on vaccination status, post-COVID conditions, and lifestyle behaviors from deceased individuals. The second method involved a virtual autopsy of young adults who had experienced sudden deaths, offering insights into the biological mechanisms behind these events. Nadda explained that researchers collected detailed information on vaccination timelines, drug use, alcohol consumption, and physical activity levels 2 days before the deaths, ensuring a comprehensive analysis. The health minister noted that receiving 2 doses of the vaccine significantly reduced the odds of unexplained sudden death. But this finding does not negate the importance of addressing other risk factors. This study identified that past coronavirus infections, family histories of sudden cardiac events, and behaviors like binge drinking or intense exercise 48 hours before death were stronger predictors of unexplained fatalities. Experts further stressed that underlying health conditions, genetic predispositions, and harmful lifestyle choices, such as smoking or recreational substance use, play a critical role in these cases. But here's where it gets controversial. While the study debunks the vaccine sudden death link, some argue that the focus on vaccines may overshadow the broader public health challenges posed by chronic diseases and mental health struggles. Should we prioritize vaccine mandates over addressing systemic issues like obesity or stress-related disorders? This question invites reflection on whether the pandemic's aftermath demands a more holistic approach to health and safety. As the world continues to navigate the aftermath of the crisis, the study's findings urge us to reconsider how we balance prevention, risk management, and the complexities of modern life. No link between COVID vaccine and sudden deaths. J.P. Nadda confirms in Parliament health safety. Imagine waking up to the news that a loved one has passed away suddenly, without any warning. The shock and grief can be overwhelming, and the search for answers can be a long and difficult journey. But here's the startling truth. Sudden deaths caused by health issues and genetic links are often misunderstood, and the COVID-19 vaccine is not the culprit. At least, that's what Union Health Minister J.P. Nadda claims. In a recent statement to the Parliament, Nadda revealed that COVID-19 vaccination does not increase the risk of sudden deaths, and instead, underlying health issues, genetic predisposition, and lifestyle choices play a significant role. But how can we be so sure? The answer lies in the studies conducted by the Indian Council of Medical Research, ICMR, and the National Center for Disease Control, NCDC, as well as the ICMR and the All India Institute of Medical Sciences, AIMS. These studies investigated the causes of sudden death and found that COVID-19 vaccination did not increase the risk of unexplained sudden death among young adults in India. In fact, past COVID-19 hospitalization, family history of sudden death, and certain lifestyle behaviors were found to increase the likelihood of unexplained sudden death. So, what's the leading cause of sudden death in this age group? According to the IMS-led study, heart attacks, or myocardial infarction, MI, continue to be the primary cause of sudden death. And this is the part most people miss. There have been no major changes in the pattern of causes when compared with previous years before the COVID-19 pandemic. But here's where it gets controversial. While the government claims that COVID-19 vaccination is not the cause of sudden deaths, some people may still be skeptical. And this is understandable, given the complexity of the issue. Meanwhile, the government has informed the Parliament that COVID-19 has claimed 164 lives between April and July in the recent summer wave. In a written reply, Union Minister of State for Health and Family Welfare, Prataprao Jadhav, shared details on the increasing COVID-19 cases in the country during the last 3 months. Although there was a slight increase in COVID-19 cases reported by states and union territories from the end of May 2025, the numbers declined significantly since mid-June. As of July 22nd, 164 deaths due to COVID-19 had been reported, with the majority of the victims having comorbidities. But the question remains, can we really trust the data? And is the government doing enough to address the issue of sudden deaths? We'd love to hear your thoughts. Do you think the COVID-19 vaccine is safe? Or are there other factors at play? Share your opinions in the comments below.